Thank you for the introduction, and I would like to thank the Academy for having let me the opportunity to present my research. I would like to tell you something about Marfan syndrome in adolescents and the adolescents' perspectives on physical functioning, disability, contextual factors and support needs, and I would like to thank my co-authors. I have no conflict of interest to disclose. So Marfan syndrome, it's a rare heritable connective tissue disease caused by a defect in the FBN1 gene, and the diagnosis is based on the revised gen criteria. And it affects multiple organs and systems, the cardiovascular system, like aortic aneurysm, the musculoskeletal system, like increased arm height, span height, as you see in the picture, also ophthalmic systems, pulmonary systems, skin striae, and facial features. So although essential for providing optimal adolescent patient support, knowledge about the impact of Marfan syndrome is very limited. So we had actually two aims in this study. First, to explore adolescents' perceived impact of Marfan syndrome on functioning, disability, contextual factors and support needs. And the second aim was to develop an adolescent Marfan syndrome ECFCY model describing the impact of Marfan syndrome on adolescents' functioning and disability. So we chose a qualitative design with semi-structured interviews. Of course, we got approval from the Medical Ethics Committee and written informed consent, and we asked 21 adolescents, 2 declined, but the 19 we interviewed, they all had a DNA mutation. There were 12 boys, 7 girls, and they had a mean age of 14.5, and 10 patients had a score above 7. So we developed a questionnaire, and we asked those adolescents like things, all open questions. So what do you know about Marfan yourself, or do you have features yourself? And what's the impact of Marfan syndrome on your activities and participation in daily life? Do you get any help or any support from friends or family? And what's the attitude actually towards your disease? What's the impact on your family life? And do you have future thoughts? And do you have support needs? So all the audio recordings we transcribed, and we used a method analysis approach. So we coded it by 2 investigators in MaxQDA, and they were structured to the domains of the ECFCY. And then we identified teams, and we identified the contextual factors who were acting as a barrier or facilitator. And in the end, we categorized all the support needs. So we identified 2 main themes: difficulties in keeping up with peers in school, sports, leisure, friendships, relationships, and they could not meet work requirements. So one of the participants said, I really notice that I'm not always able to participate. In sports, in particular, I often have to give up earlier. My knees ache a lot, so many times I have to stop before we're done. Then the second theme is being and feeling different from peers. So adolescents describe themselves as different from peers due to their appearance, fatigue and pain problems. They also perceived limitations in activities compared to peers, and adolescents indicated feeling different from their peers because of their Marfan syndrome appearance and their disability. So one participant said, it bothers me sometimes being an exception. I'm insecure because you can see that we are very tall or very thin, and people will notice the dent in my chest and ask me, what's wrong with you? It's always, that's not always nice having to tell them that you have Marfans, and I have to keep telling them over and over. Then we indicated the contextual factors reported, they were all reported acting either as a barrier or facilitator. So, for example, excellent planning or positive coping with Marfan syndrome or high self-esteem, obviously, we're acting as a facilitator, and the other way around, we're acting as a barrier. And then attitudes and support is the same. Then we gathered all the support needs, and they came up with quite some support needs. They asked advice on physical impairments, on sports activities, on side jobs, higher education, future work possibilities, but also healthy diet, writing material, or easy access to websites or contact groups. So conclusions. Adolescents with Marfan syndrome perceive limitations and restrictions in functioning, and they perceive problems in keeping up with peers in school, sports, leisure, friendship, relationships, and work requirements, and they perceive to differ from peers due to their appearance and disability. So an adolescent Marfan syndrome specific ECFC-MI model of functioning and disability with its contextual factors derived from the data, and support needs were categorized. So clinical implications. We think this all warrants awareness from medical professionals as well as from parents and the friends and the adolescents themselves. And we should make tailored physical, psychosocial, educational and environmental support programs to improve functioning and empowerment of those adolescents with Marfan syndrome. So what will we do with further research? We already conducted a survey based on this qualitative study and another one I did before. And in September, we will start physical measurements in 100 children with connective tissue disease, because this study is part of a bigger research, which is called Follow You. So thank you for your attention. Do you have questions?
Thank you very much. Questions? Can I ask you, since I'll take the chance to get started, do you think that what you found here is different from what we're learning in other developmental and structural conditions?
I'm not sure. There are differences, of course, but I think most things are the same. These children are physically, well, they have the Marfan syndrome features, so maybe that will be a difference to the other disabilities. We should see. I have no idea, actually.
It's something to think about.
Yeah, definitely something to think about.
Questions? We're blind up here with the light in our eyes, so if you have a question, you need to wave your hand excitedly, and somebody will rush at you with a microphone.
One of the things that they wanted was recommendations on a healthy diet to put on weight. Is that one, feasible, and secondly, desirable in Marfan syndrome, or is there a misunderstanding about what the disease actually engenders in terms of body shape? And
well, that's a very interesting question. Right now, they do research in the Amsterdam Medical Center on Marfan mouse, and they're trying to find a genetic disorder which actually causes the weight and the tallness. So it depends. They think that some children can gain weight, some children cannot gain weight, but it depends on the genetic disorder. So we will probably know this in a couple of years.
Any other questions? Quickly. Okay. Thank you very much.
Thank you.
Thank you.